As bird flu spreads among cows in the U.S., the CDC is planning to publicly post data on a specific influenza virus found in wastewater. Bird flu is a subtype of influenza A. It's been reported in dozens of cows across 9 states. There's also been at least 2 human cases. The agency says it has identified the virus at multiple wastewater sites. You may remember wastewater testing played a crucial role in detecting COVID-19 during the pandemic. Dr. Celine Gounder, CBS News medical contributor and editor-at-large for public health at KFF, joins me now. So, doctor, what does it mean that they're doing this kind of testing? Are they being extra careful because they learned something from COVID about early detection, or is there something particular going on here?
Well, so this is a new tool that we have to help monitor infectious disease outbreaks. It's not the only tool, and there are some limitations here. COVID was really just an infection of people, at least in the United States. With the bird flu, as the name implies, it's not just humans, right? So you have birds who are infected, cows who are infected. And so you have to look at what the wastewater is really telling you, because the waste could be coming from domesticated animals, wild animals, milk being dumped into the wastewater, humans. And in rural areas, you have septic systems. So it may not even be picking up some of the waste there.
Okay. So now 70, I understand, dairy farm workers are being monitored. Does that mean they're being monitored just to see if something happens, or what's the status of those?
So these are people who've been exposed, right, to animals that have had H5N1 infection. And so then the question is, have they or are they developing symptoms? Some of the common symptoms we know of are conjunctivitis, this pink eye, which was in the Texas case that was recently reported. We are hearing many reports of other dairy farm workers with similar symptoms. They haven't all been tested. So we are waiting for a bit more information on some of those cases as well.
And how would they get it if they tested positive?
Well, this is a great question, and this is why we need more data. You know, wastewater is not going to be able to answer all of the kinds of questions we have. And so some of what needs to be done is testing of the farm workers, figuring out how they were exposed. So was it through handling of milk or milking equipment? Is it maybe aerosolization of the milk or virus into the air, so you're getting into your eyes that way? Is it breathing it in? We don't entirely know for sure which of those is the cause here. It could be all of them.
And does it matter whether it's pre or post pasteurized?
Yes. So pasteurized milk really does a very good job of killing bacteria and viruses. This is why Louis Pasteur back in the 1800s came up with pasteurization, because back then people would get sick. Raw milk, think of it as raw sewage. It's heavily fecal contaminated. Think about, where the cows, their feces are. This is not clean. You really want to be drinking pasteurized milk.
And I'm going to admit now I'm really not going near any unpasteurized milk. So how concerned should the regular person watching here who hasn't been on a farm recently be? So
if you're not having direct contact with poultry or dairy cattle, those are the 2 types of animals that have been infected in the United States. If you're not drinking unpasteurized milk or raw milk, your risk as a member of the general public is pretty low right now. What we're concerned about is if this continues to replicate and mutate and evolve, whether it's in mammals or humans like dairy farm workers, that's when there's a risk of it evolving and adapting to humans and person-to-person spread.
And it jumps, and that's
what we worry about. That's what can cause a pandemic. So it may not be today, but say within the next 10 years, if we allow this kind of thing to keep going, that's what we're worried about.
And by then it's too late if you haven't learned how to.
Yep, exactly.
Thank you so much for being here, doctor. It's always a pleasure.